great question. Oh my God, I'm so glad you're here because I've got no idea. I've always thought I have lovely freckles. Turns out it's sun damage. What's the best way to get rid of this? So can you tell us about that?
Okay, so that's a difficult one. A lot of the time, when people have freckles, they don't want to get rid of them, but they want to get rid of other pigmentation that they have, which is really challenging because you can't really do both. Because freckles are basically sun damage. Sometimes they can be genetic, sometimes it can just be through. My daughter has freckles all over. I know you've got a freckly child as well.
Yeah, I love their freckles.
I know, and I love her freckles too. But as you age and you get older, they start to look more like brown spots, and people decide that they don't like them and they want to get rid of them. You can get rid of them. They can be quite tricky to get rid of, particularly in darker skin types. In lighter skins, you can try IPL options. You could try laser to target pigmentation, especially when you have a real contrast between sort of a light skin and a darker pigment. But the main way to really target pigmentation, I find, is to use prescription skincare. It's the safest way, certainly, whenever you use any light treatments or laser treatments, there's always going to be a risk there. There's always going to be a risk to the skin, particularly darker skins. So I use a lot of Abaji products, as you know.
Abaji ambassador.
Abaji products, because I love them. I absolutely love them, and I'm so happy to be the Abaji ambassador because I have used them for years on my own skin, and I've seen my own skin transform. I've used it on so many patients, and it just blows me away when I see the results.
That before and after on our page just now. I won't say. I was about to say her first name, which obviously I can't do. But that before and after is incredible. That was just wow. You couldn't do better with Photoshop. That's brilliant.
She struggled for years and years with her skin, which is really sad. She's now in her mid-20s, and this is the first time her skin's been clear in her adult life, which has a real effect on people, emotionally, and people's confidence as well. So I really believe in their products. I think that they're absolutely amazing, and like I said, I wouldn't use them myself otherwise. My husband uses them. I bought them for my brother. You know, they do so many different things. Because
they're sitting on my shelf.
Gathering dust. But they work so well. They've got so many active ingredients. They are medical-based products. So if you want something cheap and cheerful, or you're just looking for a nice moisturizer, then go to any pharmacy, or I don't want to name the pharmacies, but you can go anywhere and get something over the counter and it'll be nice. Or you can go to any shop that sells a kind of more of a cosmetic product. But if you're looking for something that's going to target an issue that you're having in your skin, whether it's acne or rosacea or pigmentation or scarring, then you really need to be looking at getting actives into your skincare regime, because anything that you buy over the counter isn't going to work. Even if it says it's vitamin C, it's going to be such a small vitamin C, it's going to be a derivative, so it's not going to be very active in your skin. So when it comes to pigmentation, I use the Abaji Nuderm kit quite a lot. There are different kits that you can use. There's another one that you can use for sort of pigmentation that's not quite so severe, but I get amazing results with Nuderm, so I tend to stick with Nuderm, and that contains 2 prescription ingredients. It contains hydroquinone, which is a lightening cream. It's a tyrosinase inhibitor, so it basically stops the pigment where it's being produced, rather than just treating the pigment on the surface. So it's actually fixing what's going on in the skin rather than just treating the symptoms of the pigmentation. And then you combine that with a prescription vitamin A, and vitamin A is amazing for the skin in so many ways. It helps to regulate your skin cell turnover, so it sheds off all the surface dead skin. It actually, a lot of people say to me, oh, well, it thins the skin. It doesn't thin the skin. What it does is it thins the outer layer of skin, which is the kind of dead layer anyway that become dull. It thins that layer, and then it thickens the dermal layer, which is the layer that has collagen, all your elastin. It helps to stimulate collagen. It helps to increase the water content of the skin. It really is things. So it combines those two ingredients, and actually you mix them together, and what the vitamin A does is it carries the tretinoin deeper into the skin that targets the pigmentation. So so that's really, really effective, because you're treating the root cause of it. But with pigmentation, there's not really, you have to very much look at pigmentation like there's no cure for it. You're looking to suppress it and then maintain it, and that's quite hard for some people to get their head around, because they just think, oh, I'll just come in and get rid of my pigmentation and it'll be gone. But the reality is your skin cells have a memory. So if that skin cell used to be a pigmented cell, and then you go out and have 20 minutes in the sun without sunscreen on, that will repigment. And you can literally undo months of hard work with using products or having treatments with the smallest amount of sun exposure. And when I talk about sun exposure, I don't even mean sitting out in sort of 25 degrees. Like every single day of the year, you should be wearing SPF, because you get your UVA rays that are present all year round, and they're the rays that penetrate about 40 times deeper into the skin. They age you. Sorry, am I going on now?
No, Bex is taking a photograph and she just lets me smile.
Sorry.
I get like too excited.
Sorry, Jenna.
You're in it. No.
So sunscreen every day is super important for absolutely everyone. Every single patient that comes to me for any type of skin treatment, any type of injectable, what's the point in doing anything from a rejuvenating or anti-aging point of view unless you're doing the basic thing, which is protecting your skin from the sun. You're protecting your skin from a health point of view, from UV radiation, but also from the aging that you get from the UVA rays. So
yeah, cool. It's interesting what you were saying about it not thinning the skin. Were you talking about your vitamin A not thinning the skin, and that it thins the epidermis, which is the dead stuff, and thickens the dermis? Interestingly, exactly the opposite happens as you age, obviously, and exactly the opposite. In plastic surgery, we sometimes need to get more skin, and we'll insert a tissue expander somewhere. Say we're reconstructing a defect, and we'll expand out someone's skin. Or say, you know, you're doing, you put a skin graft here, so it's a bald patch. You might expand out a bit of hair-bearing scalp to sort of put over the top. Any expanded skin shows a thinning of the dermis and a thickening of the epidermis, a sort of compensatory thickening. And so it's these, you know, aging does it, stretching does it, weight gain, pregnancy skin, anything that stretched it. So it's interesting that this is something that reverses that process.
yeah, I can even, I don't know how about you, but in some patients, you have some patients that just only want to maybe have injectable treatments and they don't want to take care of the skin. Quite hard when you have that battle, because skincare is very much goes hand in hand with having any treatments. And what's the point in keeping your forehead smooth if your skin texture and tone isn't bright and luminous? So yeah, I find it even sometimes when I'm injecting, you can feel when people have got a really thick outer layer of skin. You're like,
it's hard to get through. That's right. And it's not. You're right. If you were to do one thing to rejuvenate yourself, you know, good-looking skin would be it, wouldn't it?
Absolutely. And it doesn't have to cost a fortune. It's literally just about keeping a good couple of actives in your regime, or getting a couple of actives into your regime, because quite a lot of the time people come into me and they say, oh, well, I'm using this and I'm using that. And I always look up the product that they're using and see what the actual ingredients, because they think that they are the right ingredients, but they're not using the right formulations. So a lot of the time it's just about a couple of just small changes. I would never tell anyone that they had to change their whole regime, ever. If people are on a cleanser and they're happy with the cleanser, then stick to it. If they've got a moisturizer that they like, then absolutely stick to it. The Obagi one is very good. And so if you haven't got a good moisturizer, generally the Obagi Hydrate is my one that I always go to. But a couple of actives and an SPF can literally change someone's skin, and it doesn't have to cost a lot, but it's just about getting the right things in there and making sure that they're using them on a regular basis.